Do you or your loved ones struggle to stand up? Do you have problems getting out of a chair? That can be a huge struggle for older people. I have been a nurse for 30 years and owned a care home for the last 10 years as a registered nurse helping the people that live with me. And standing up has to be one of the biggest struggles that people struggle with who are living with me. And I know that they want to stay independent. And so over the years, I have gotten where my favorite gadget today is an electric lift chair. It is a great invention to help people be able to stay independent with standing up and not have to struggle so hard with their standing. And you might be saying, why is this a great thing? And what is an electric chair? Isn't it just like any old recliner that you lean back in and your feet come up? And it is. I mean, this thing is great for afternoon naps, for raising people's legs up so that they can get good circulation improvement in the afternoon, something that people struggle with. But the greater thing about this baby is that with the push of the button, the legs go down and then the whole chair is actually going to lift up and help me to stand. This is great for those people that are struggling to stand. And I think that it is a big game changer. When I started out as a nurse 30 years ago, we didn't have these. And so we were always having to just manually lift people into the standing position. But with this chair, now I'm all the way up and I can literally just lean forward and go to stand, which is a great thing for people to be able to maintain their ability to get up on their own and maybe not even need a caregiver. And then you simply sit back down, push the button, and it goes back down. It's very slowly so you don't get knocked over. Nothing scary about this chair. But I do have to warn you, there are 3 cases where I use caution with this kind of chair. They are, number 1, it's great that it helps you stand, but if you become reliant on this chair over time, your ability to stand on your own will decrease. And so that is an issue that I'm always thinking about. And so how I handle that with the people who live with me is that I recommend they only have it lift them as far as they really actually need it. And that might only be just a tiny amount, just to hear maybe. Just that little bit can make all the difference in helping someone to be able to get themselves to standing. So that's the first thing that I recommend for those people. Next part of it is to make sure that you continue to walk and do other exercises to maintain your strength, because it's great that this chair can help you, but if you lose your overall ability to walk and transfer on your own, then it won't matter that the chair helps you up to upright if you can't then move forward. The second person that I use caution with is someone who doesn't have a good sense of where they are. And I see this happen a lot with older patients, especially people who have had a stroke. And what happens is that when they push the button, they don't always realize that they're going up rather than leaning back. And I know for those of us who are still able-bodied, we can't understand how they couldn't notice. But I have had people, more than one, who would get themselves all the way into the upright position, and then they would slowly slide out of the chair and end up on the floor. So that is not optimal. We don't want people falling. This chair is to help us not fall. So make sure that you're cautious if your loved one can't remember to make sure that they're going backwards. And even people who haven't had a stroke, I've noticed when they sit down in it and it's already up and tilted because that's how they stood up from it, a lot of times it's funny, they'll sit down and they won't remember to put it all the way back down. They'll think that they're down. And so I always do a little walkthrough and make sure that they've put themselves all the way back down to avoid that problem. And I have a whole list of tips that you can get It's an easy caregiving guide. Just type tips in the comments below and I'll send that to you about the other things that I do to keep people safe. But the third person that I'm really careful about with this chair is someone who has dementia and can't remember that this is how you get the feet down. And so they'll get back in position in this chair, they'll be leaning back and they'll be sleeping, and then when they wake up, they don't know how to get out of the chair. And so what they will do, usually this is a dementia patient, they will slide forward on the chair until they're sitting on the footrest portion. And this is very dangerous, especially in the chairs that aren't very heavy, because now all of their weight is far out and it's not centered over the seat part. And sometimes with the lighter weight chairs, it will actually flip forward. So that's a scary thing because they're going to end up on the floor with the chair on top of them. I've never had that happen. I've seen it almost happen a few times. I got rid of the chair that I had problems with that with and switched to ones that are a little better balanced to avoid that issue. The other thing that I do if you have someone like that who doesn't remember to put their feet down is that I don't let them have this chair in their room. Anyone who's having problems operating it, I might make sure that it's just sitting out in the living room where I can keep a close eye on it. The other thing that I'll do for people who are having problems working the controls is I'll take the controls away. So this would go for the person that likes to dump themselves on the ground. I just take the controller away so that they can't get confused about ups and downs. And I have call pendants in my care home, and so when somebody doesn't have the controller, wants to change position, they just push the button and I come in and help them. So, but I have to tell you that in addition to helping the person stand and their mobility, the thing that makes me love this chair the most is the positive effect it has on the caregiver. As someone who's worked in nursing for 30 years and known the extreme risk that nurses face with back injuries because of all the lifting that we do, this chair, I think, is a game changer for the nurse or caregiver because it saves your back. I can literally just stand next to somebody and help them run the controller, and they can get up to upright on their feet without me having to lift. And that is a huge, huge benefit of this chair. And that's why, even though it has those 3 negatives where I use caution, I still use this chair every day in my care home for the people who live with me. And I would recommend you considering it for your loved one also. If you want more hints on how to be a better caregiver, a more efficient caregiver, or maybe you're just an older adult who wants advice on how to age well, check out my next video and I will see you there.